First up, it's WellHealth Medical Week on the Morning Blend, and we think you'll find the topics we've lined up to be extremely interesting and helpful.
That's right, and here to get the ball rolling and introduce us to WellHealth Quality Care is Dr. Warren Volker, who is the Public Relations Director, Meghan Bailey. Good morning to the both of you. Welcome back.
Good morning.
Good morning.
Thank you.
Good morning.
So WellHealth Quality Care, what is it?
WellHealth Quality Care is a multi-specialty accountable care network made up of some of the highest performing physician groups here in Southern Nevada.
And tell us about some of the services you provide.
So as you learned last time we had WellHealth Week, we have the WellHealth Metabolic and Hormonal Center. We also have 3 other centers, the Las Vegas Minimally Invasive Surgery and Women's Pelvic Health Center, WellHealth Anesthesia Associates, as well as WellHealth Women's Specialty Care. And we also have 20 other subspecialties.
Wow. So, Doctor, what will we be focusing on this week?
This week is kind of my area, and that's focusing on minimally invasive surgery, pelvic surgery, and women's health in pelvic surgery.
And let's talk about some of those services, though, at the center, what you specifically do.
Well, at LVMIS, Las Vegas Minimally Invasive Surgery, Women's Pelvic Health Center, we do 2 main things. We deal with issues, women of all ages, even young women all the way up to older women that have pelvic issue problems, from pelvic pain, endometriosis, to prolapse, to precancer, and all of those things.
How is LVMIS changing the landscape of women's care here in Nevada?
Well, probably the most unique is it's actually a recognized international center, and we do training there. We actually have a fellowship. We train surgeons. We've been accredited by an organization who credits us, the AGL, and so we do research. We're training surgeons, and we actually draw patients from all over the world. We've had patients from Saudi Arabia, from New York, from China.
To seek out your help.
Correct.
That is incredible. Now, for people who come and visit to get things done, do you normally take insurance as well? Is that something that's...
We do. We accept most insurances.
Awesome.
Okay. And that's something that you want to check ahead?
Yes, of course, of course.
LVMIS, where's that located?
It's located the Southern Hills, adjacent to the Southern Hills Hospital in the medical building, Suite 100.
Awesome. Now, let's talk about minimally invasive surgery. This seems to be, because who wants maximally invasive surgery? The leaps and bounds that medical breakthroughs have been able to stop a lot of cuts from being made with these surgeries. It's pretty amazing, isn't it?
Yeah, it is, and really the 80s is when all this started to take effect, when we learned how to do surgery through what we call small ports and incisions, and able to do surgery through 5 and 10 millimeters. And you know, like people that get their gallbladder out nowadays, it's traditionally done now through small operative scopes, and we actually have been doing that for the last 11 years as well.
Yeah, and this brings up the topic of getting your checkups with your doctor. Make sure everything is okay, because once you find out if there's a problem, and to go and have it corrected or go to surgery when you're at a phase where you can beat it is to your benefit.
Yeah,
it is.
Yeah, that's a great point, because believe it or not, 20% of the patients that come to us actually were seeing a doctor, and it was found on a routine exam, and they'll find a mass or something that needs to be followed up on, and they come in, and it's true.
And these are gynecological services. These are obstetrics, right?
Correct.
Right.
This center focuses all on women's health, mainly gynecological issues specific to that.
And when it comes to going to see your doctor and getting the checkups, what do you recommend women do?
And we'll be talking about that all week as well, but you know, in women's health, it's very specific. Yearly examination is still very important. At a certain age, usually 40 and above, the mammography. But there's a lot of screening that goes into it, and there's a lot more that goes into just physical exam, from cervical cancer screening with pap smears, and then just education.
Megan, I know that we have a can't miss segment tomorrow.
We do. We
Tell me
do.
about it.
Well, we're about to get personal with the ladies. You know, a lot of women feel that some of these issues are taboo, and they don't need to be. And so we have Dr. Dingra coming on tomorrow to speak to you guys.
We're going to tackle those issues.
We are going to tackle those issues.
Very important.
Yes.
Yeah, so we'll be meeting him tomorrow?
Her.
Her. It's
yes,
okay,
it is. So that makes it, you know, even if it makes you feel a little bit better.
More
Dr.
comfortable.
Dingra. Yes.
Okay. It's a
Well,
pleasure.
thank you so much.
Oh, thank you.
See you tomorrow.
All right, thanks.
Right, to schedule an appointment or for more information on LVMIS, just head to the website or call the number on your screen. And be sure to tune in tomorrow for some great info on how to really talk to your GYN. Still to